So I'm an assistant clinical professor in the Department of Psychiatry here at UCSD in the Department of Neuropsychiatry and Behavioral Medicine, which is a conglomeration of a lot of different parts of our department. It includes inpatient psychiatry for people who are pretty severely mentally ill. And in addition to that work, I do work within the hospital setting, within the general hospital setting, so patients who are here being treated for other medical illnesses and have also psychiatric or psychological problems, I'll often see them. And the primary bulk of my work is in working with patients and trainees who work with patients with chronic pain, chronic illness, and along with that depression, anxiety, and all of the sorts of psychological disorders that most outpatient clinical psychologists will work with. Went to graduate school thinking I was going to be a private practice psychologist doing psychotherapy with people who were depressed and anxious and that sort of thing, and have found myself here in a medical setting doing a whole variety of work. And it was here that I discovered or came to know mindfulness and its application in working with a whole variety of patients. Mindfulness is really about cultivating our awareness that what we have in the world is what we have right here in this moment. And that everything else is something we've thought about the future, something we've recalled about the past, some ideas we've had about how things are or how things should be. But when we kind of boil it down, all we really have is a present moment, what's right here in this moment. And some people have suggested that distress or suffering is really very simply the struggle with what is. If you think about that for a second, what does that mean, the struggle with what is? Even if you use something like driving to an appointment and you're late, and you're stressed out because you're late. Well, that's how we would describe it in simple English terms. I'm stressed because I'm late. What's stressful is that we're here and we don't want to be. We're here and we want to be there. We have thoughts about what it's going to mean if we get there late. The judgment that causes our suffering is what we put on top of what we actually have. Just accepting that what's here is here, and being able to meet ourselves at that particular point and to be able to see ourselves clearly and see our situation and then decide upon a way to proceed. So how does that relate to depression? That whole idea about changing the person's relationship with the activity of their mind is really so parallel or so intertwined with what mindfulness is about, which is observing, just watching all of this activity of the mind, that because I'm sitting here and I have a thought doesn't make it real, doesn't make it something I have to follow or believe in. It's just a thought. Easy thing for me to say. It's a hard thing to do when you encounter a situation and the thought that comes into your mind is, I'm no good, or I've never been able to handle things like this, or I'm not very bright, or whatever it is. But slowing down, paying attention, practicing mindfulness, which really the means by which we teach people mindfulness is meditation, stopping, moment to moment, non-judgmental awareness of whatever is here. First of all, major depressive disorder, when a person is in a full-blown major depressive episode, meditation may or may not be the thing that's called for in that moment. We certainly don't have any evidence of that mindfulness or mindfulness-based cognitive therapy for depression necessarily is indicated for someone in the midst of a major depressive episode. Often this is a person who's very isolated, who has little energy, who's physically ill in some ways because they're not eating or sleeping. So I don't want to imply that mindfulness is sort of a cure-all for anyone at any stage of the disorder or the diagnosis. That having been said, someone may ask, well, why mindfulness? And why not just take the medication? Or why not just cognitive behavioral therapy or whatever? And my first response might be a little too flippant, which is that why is in your head. Okay, asking the question why, or why do I have depression, or why won't it go away, or anything else is sort of an interesting exercise, and it's what researchers and psychologists and psychiatrists often muse about why does this disorder happen, and certainly that's important for understanding the mechanisms of it. On the other hand, asking the question why, beyond being an interesting intellectual exercise, probably doesn't lead very far to any sort of relief or any sort of different way of being in the world if you know why you're depressed. Because most of the time, we have enough trouble just being aware that we are depressed and what it's like to be depressed, and tuning in fully to our own experience. That why has to do a lot with what was in the past, or has to do with a lot of intellectual exercise that isn't relevant to our direct experience. Our direct experience is that we feel a certain way if we are depressed. We feel a certain sensations in our body. We have a certain amount of energy. We have certain thoughts that pass through our minds. We have certain emotions that we feel. All of those things are our direct experience, and those are tough enough to deal with, much less trying to add in an explanation for why we have them. And that's true of literally every situation we're in. We can spend a lot of time wondering, why me? Why did I end up being this tall, or having this color hair, or born into this family, or all sorts of interesting things that are just the reality of our situation, and consume a lot of our energy and don't do us a whole lot of good in terms of our quality of life. We're very much in the mode of wanting to fix whatever is wrong with us. And sometimes depression has a lot to do with struggling with the things that we see are wrong with us, and maybe even losing our perspective about how much is wrong with us, such that people are sometimes shocked when I'll look them in the eye when they come to see me. And I'm talking about people who meet criteria for major depressive disorder, or have chronic pain, or have cancer, or have to undergo a liver transplant, or any one of a number of other things, and I can look them right in the eye and say, you know what, I firmly believe that there's more right with you than wrong with you. And that's such an amazing concept, especially for someone who's struggling, for them to realize that that's true. That we do perhaps have fleeting or difficult feelings, or we may have physical problems or challenges, but we focus on them so closely that we lose track of the fact that there is way more right with us than wrong with us, that we have both strengths and weaknesses. It's just that we get so focused on the weaknesses, or so focused on trying to figure out what's wrong and fix what's wrong, that we don't even notice some of the other aspects of us. And this is not about being like Pollyannish or overly optimistic, or saying everything's going to be okay, or anything else, but just recognizing that we have everything we need. We have all the tools we need to be able to cope with the world. We sometimes can't access them, and sometimes we feel like there is no way to get to those things that we need, or we think we've lost the ability to cope. And really what this is about is slowing down, tuning in, paying attention, and recognizing that we have whatever we need within us. We have the ability to look at the world in a different way. We have the ability to choose whether or not we believe the thoughts that pop into our heads. We have the ability to choose to sort of reconnect with who we are as human beings. And I think that's ultimately the hugest, most powerful thing that we do in teaching mindfulness. I think one good example is a gentleman that I've worked with off and on for a couple years, who is a guy who has a significant degree of depression. And that's partially related to the fact that he has a significant degree of chronic pain, chronic neck and back pain, and some really difficult physical challenges that he faces. And this is a guy who I think of as a real fighter. He's very much of a sort of go-getter, has always been a very marketing, sales-oriented sort of guy. He was an athlete, things like football and wrestling and that sort of thing growing up, and lived in a fairly tough neighborhood. So this is a guy who's a fighter. And he was taking on his pain in the same way, which you can't blame him for, fighting with his pain, doing what he could to kind of overcome it, and not to cast that in a negative light necessarily, but he was finding himself outmatched at times with all that he faces. And in the course of mindfulness, I talked about it right away, and he said, "Oh yeah, living in the now, I know about that. That's that sounds really good. It's a really hard thing to do, etc." But he was willing to try anything. He was somewhat desperate, and so he went through my mindfulness class. Actually, has been through it a couple of times. And little by little, what he discovered in that process was that a lot of what he was fighting with was reality, was things as they are. And he was taking it on and wrestling with it. And he learned that there were a couple of things he could do. One of them was he didn't have to fight. These things were coming at him. They were in his life. They were real things that needed to be dealt with. But he could actually deal with them in a variety of different ways. And what he discovered was, instead of fighting with it, he could dance with it. And that's how he describes it. He describes his depression as this sort of big looming monster that comes to visit him from time to time and threatens to sort of suffocate him. And he sometimes takes a sort of playful attitude with it. "Oh, here you are again." And sometimes he engages with it, but instead of trying to push it away or kill it or squash it or pretend it's not there, he dances with it. He just relates to it in a different way. And that's allowed him nothing's changed. He still has the same physical problems. He still has generally the same social situation. He still has the same activities, but he has a different outlook. He actually feels like there's some movement, like he's not cornered, like he can actually see these things and watch the depression come into the room and then leave again. Or watch the depression come into the room and push at him a little bit and nose him around and then leave. He can just kind of move with it in a whole different way than he ever did before. So it's not he woke up one morning and suddenly he wasn't depressed, because he has things to be depressed about. And that's usually what depressed people will say is, "I'm entitled to be depressed. I've got this, this, and this that are wrong." And it's not about taking away those things, although it would be nice if we could. It's about being able to relate to those things in a different way. So it's a slow, gradual process that if you aren't paying attention, you won't notice. But the process isn't going to be happening unless you are paying attention. So it requires a stepping back. The therapist is a step back because that person can look sort of objectively at the whole situation, see it from a different angle. But the amazing thing is that we are able ourselves, with a little help from a therapist or sometimes just on our own, with the use of mindfulness, meditation, concentration practices, to step back from our own stuff and see it from the side and see, maybe the problem isn't this, it's that. Someone said the other day, if your wife has locked you out of the house, your major problem is not the front door. Your major problem is something different. You may define it as the front door because you're trying to get in, but the problem is different. The more fundamental problem is, of course, how or why it was that you got locked out to begin with. But if we define the problem wrong, we can't fix it. We can't address it in any way. And as I said, fortunately, we're human beings who have these amazing organs of the brain inside of us, and it's not so fixed. It's actually flexible. It can actually learn new ways to solve problems.